What up? Let's make some breakfast. I have my Wonder Bread for toast. Best bread you'll ever have. Wonder Bread. I remember when Hostess went out of business, I was miserable. And the only bread I found that came comparison to close, not the same, but close, was Stop and Shop. Oh, the smell. It just smells different. It's softer. I don't know. It's just so much better. And then we're going to do some strawberry. I keep them in this container and they last longer. I need a plate. I don't know why they last longer, but they do. If I keep them in that container that it comes in with the holes in it, 3 days maybe they'll last. I cut them down and then I cut it in half this way. And then I cut them like this. So it makes it seem like you have way more strawberries than you do. They fall in faster. I just got a colonoscopy and everything came back normal. I still have damage in my smaller intestines. They don't know how I got that, but it's not bothering me, so it's fine. So I'm done with that, thank God. Now I have to schedule a mammogram. I went to go see my doctor about weight loss medication and stuff, which he prescribed. I'm just waiting on a prior approval for that. And he freaking sent me a message at home. Make sure you do your mammogram screening. I'm like, yes. More appointments. As a person with chronic illness, appointments. I have to make appointment for my physical therapy for my knee. I can't find the freaking paper for it. I'm going to have to call a doctor's office and ask for a new one if I can't find it. Because my arthritis is that bad. And my knee, I use a cane right now for it. My phone just jumped because it's against the toaster. And the toaster went off. So, anyways, I have that appointment. I have to make my 3-month kidney appointment so they can check my kidney levels and everything and make sure it's not deteriorating where I'll need dialysis. He said I will need dialysis most likely when I get older, like 50s, 60s, he said. But he said for now I'm okay. They did a genetic testing for my kidneys and they found another disease called Alport syndrome. It's genetic, so I have to get my son tested because he does have lower lobe hematuria. He does have a kidney disease. He gets blood and protein in his urine just like me. But mine's is severe because I have a nerve disorder called RSD, reflex sympathetic dystrophy. And it just adds, and I get chronic pain in my back where my kidney is. So, I'm glad that he didn't have to deal with that. But I still worry about him a lot. Because when he was in middle school in 7th grade, he had pneumonia. And it would not go away. No matter what we were in the doctors every single day for like 3 weeks. No lie. And every day he had to go in for a breathing treatment until I'm like, I have a breathing one at home for me. Can I use it for him? So they just prescribed it for him there so he can do it at home. And he was home for 3 months. A teacher actually came to my house to teach him. He has a heart condition He gets fatigued very fast. He gets sweaty. If he's in the back of the car a little too long, he gets car sickness. Sometimes even right away. So it's probably better for him to ride in the front. But he's had episodes sitting in the front and back. So we don't know what the problem is there. But yeah, he has to go see the doctor too to get his levels checked. Make sure his kidneys and his are not acting up. And then I have my Social Security hearing because they're trying to take away my Social Security. I don't know why. With all the sicknesses and medications I take. Do you want to hire somebody that's on oxycodone and morphine? I wouldn't. Because they wouldn't be able to stay awake. And I'm on high doses. I'm not on no little doses. I'm on high doses. So I take 60 milligrams every 8 hours of the morphine and then 20 milligrams of the oxycodone every 8 hours. So yeah, and I take a bunch of other pills like gabapentin and tizanidine. Gabapentin is a nerve to help with my RSD and my kidneys also. And I just found out that Ozempic helps with chronic kidney disease. So I'm going to go ask my doctor about that. He's putting me on another GPL-1. I'm waiting for the prior approval. And if not, I want to see how much it'll be for me. And see if I can get it at a reasonable price at my pharmacy. Or if I'm going to have to buy it somewhere else. He thinks I'm a great candidate for it. Because he doesn't think I need a weight loss surgery. I just need something to help with manage my weight. Because my weight fluctuates. From 2 to 230, I'm in there all the time. It goes up and down, up and down. So I need to lose weight for my health, for my knees. Because when you need a knee replacement, the other one's in the beginning stages of arthritis. So I don't know what to do about that. But I'm going to work out with my physical therapist. Oh my God, I didn't realize. Look at that line. I got burned at my sister's house on June 15th. And it's still burned. That didn't turn brown like a tan. I had bracelets here. So it like blocked it. And now that I have them off, they're freaking... Look at that bruise from my IV. They pricked me twice. Thank God, only twice. Usually it's like 4 times they try. I'm the worst person to get an IV. I told her where to go because I felt it, but she couldn't see it. And she's like, you know what, we're going to do it blind. Let's go. And I wish I could find her every time I'm in the hospital. Because so many people just don't know how to do it. Like, I'm a hard prick, yeah, but you don't have to prick me 10 times. It's annoying. But anyway, yeah. So my kidney disease, chronic pain disorder, nerve disease, RSD, I have the works. I have high thyroid, I have high cholesterol. And high cholesterol I had when I was thin and when I'm bigger. It's hereditary. My whole family has it. My sister's one of the healthiest people I know and she has it. So, but that's all I got for you. Gotta eat my breakfast, take my medication, and go to bed. Bye.